We're going to talk about Medicare plans in California, and things are a little bit different in California. If you live there, you likely know that there are more regulations in California than in a lot of other states. And they do have some different things with Medicare that other states don't do. So we're going to go through that right now. So if you're coming into Medicare and you live in California, or maybe you're already on Medicare and you're going to move to California, it's important to understand the differences. And I'm Keith Armbrecht, founder of Medicare on Video. I help people across the country make the right Medicare choices. I'm an independent broker, so I don't work for any particular insurance company. I work for you, and the great part about it doesn't cost you to let me help you. So whichever insurance carrier we choose, they pay me a little to be your service agent now and in the future. So you'll always have help there when you need it. So hopefully you'll allow me to help you with your Medicare choices, and we'll make sure we get all your pieces put in the right places. Right now, we're going to talk about Medicare in California. And if you would, just take a second, like the video, subscribe to the channel so you'll have access to my videos. Hit that little bell because that'll give you notifications when new ones come out, and everything will be there for you when you need it down the road. If you stay till the end, I'll also show you how to download my book, Medicare Made Clear, that you can have right now for free. So there's no cost to it, and it's a great resource to keep on your computer or your iPad, again, for future reference, because things will always come up. So when we talk about California Medicare, you know, what makes it different? Well, California does some things, and they're really designed as protections, and they're beneficial in certain senses, but they also can make prices a little bit higher. So we want to make sure we maximize our value and we understand everything that we have to our benefit, and then how to make it work for us in the future. So California doesn't go as far as some other states like New York, where they put in a lot of regulations and kind of a lot of protections, but it also makes the cost go way up. California is a little different. So let's talk kind of from the basics. When you're coming into Medicare in California, you first will have your first choice, whether you go Medicare Original or whether you go Medicare Advantage. And that's kind of the same across the country. That's your first choice on what road you're going to take. And if you need to watch one of my other videos to get a clear understanding of which way to go, and if you watch my other videos, you'll know I am not a fan of Medicare Advantage plans. I don't like the restrictions. I don't like the fact that you have to work within a network of doctors and hospitals. I much prefer Original Medicare, where you can choose any doctor, any hospital in the country. So whether you're traveling or not, you just can go anywhere you want to go. And that's, to me, a very important part. But when you look at the two side by side, one of the first things that people kind of get a little confused with is the Medicare Part B premium. So when you come into Medicare, Medicare Part B has a premium. And in 2022, it's going to be $170.10. Now, you're going to pay that Part B premium regardless of whether you're on Medicare Original with a supplement or Medicare Advantage. So a lot of people think Medicare Advantage, you don't have to pay that anymore, but you do continue to pay your Part B premium. Now, understand also, it's income adjusted, so it could be higher than that. That's the base amount for the Medicare Part B premium. So that's your first choice when you come into Medicare. And again, it's the same as just about any other state in the country. Which way are you going to go? And what I absolutely prefer and recommend is Original Medicare with a Medicare supplement, likely a Medicare drug plan. You're going to wrap everything up together, and your cost is going to be, it's going to be predictable. So you're going to know exactly what you're going to spend, because it's all mostly just the monthly premium. So for instance, if you are on a Medicare supplement plan G with Original Medicare, you're only out of pocket for the entire year when you use it is the Part B deductible, which in 2022 is $233. That would be max out of pocket for the entire year. With Medicare Advantage, it's different. You pay as you go. So as you use it, the costs are generally significantly higher, and they can reach an out-of-pocket maximum of up to about $7,500 per year versus that $233. So it's important to make sure we get that choice correct in the beginning. So where California is different is if you are on Original Medicare and you have a Medicare supplement plan, so you're already in Medicare and you have a supplement plan, and you want to change that Medicare supplement plan. In most states throughout the country, you have to go through medical underwriting. When you first come in, you don't have medical underwriting. It's guaranteed. You pick whatever you want and they can't say no. But after that, generally you have to get approval in order to qualify for a different Medicare supplement plan. So if you get any rate increases or things like that, then it can change. You might want to change companies, keep the same plan, but change companies. So what California has done to give you a right to be able to do that is they have what's called the birthday rule. Now, California has the birthday rule. Oregon also has the birthday rule. And what the birthday rule does, gives you a window each year, and it's wrapped around your birthday. It's 30 days before your birthday, 30 days after your birthday, where you can change your Medicare supplement plan to another company. So if you got a rate increase from company A and company B has the same plan G or the same plan M for less, you can change without any questions asked. So it's actually a very good rule. It does raise premiums a little bit because that's what insurance carriers do when they're kind of forced to take people without medical underwriting, is it does increase the premium, but it's not terribly bad in California. It's much worse in New York, where they give even more protections. But when we're talking about the cost for a Medicare supplement plan in California, we still want to be close to $100 a month. So, and it's going to be somewhere between $150 and $100 on your monthly, depending upon whether it's a plan G or a plan N in your particular zip code. And it's going to be closer usually to $100 than it is $150. So it's not an outrageous expense, but we want to make sure we find the absolute right one. So in California, with the birthday rule, Medicare supplement is a fantastic choice. It's absolutely the choice that I would choose. I would pick original Medicare with a Medicare supplement plan, and knowing that if we get rate increases or things like that from an insurance company, we always have a window to be able to better that. And I have another website called Medicare Price Check, where that's what we do every year, is we shop and we compare and we make sure that we have the lowest price. Because again, on a Medicare supplement plan, a plan G is a plan G, a plan N is a plan N. It doesn't matter which carrier, they're all standardized, they're exactly the same. Now, caveats to this birthday rule is you must already be on a Medicare supplement plan. So you must have one already, and you can only go to equal or lesser value. So in other words, you could go from a G to a G, or an N to an N, or a G to an N. But you couldn't go from an N to a G without medical underwriting. In other words, improving the coverage. You also could not be on a Medicare Advantage plan and then use the birthday rule to get a Medicare supplement plan. So it's designed really for the protection of if we get rate increases on our Medicare supplement, gives us the ability to change the company and get a lower price, which is absolutely what we do all the time. So that's exactly what I do, is I help with all that. I make sure we get the best start, and then I make sure we get the best finish as it comes along. We want to continuously keep an eye on this so we make sure that we're always in the best position. And again, what I would do is I would almost never choose a Medicare Advantage plan. There are absolutely people that are happy with them, and generally they're happy with them before they start to use them. And then it's when you start to use them and you need things like referrals to go from a primary to a specialist, things like that, that just really don't, to me, make sense when you're, especially if you're in a significant health situation. So I'd much rather have the freedom to do whatever I want, go wherever I want, and still have very low out-of-pocket costs. So a Medicare supplement with original Medicare is fantastic coverage. And again, a plan G gives you max out-of-pocket of $233 for the year. And if you had a plan N, it's the same $233, but would have a $20 copay when you go to the doctor. So very low on the out-of-pocket costs, and just makes a lot of sense to me to do that. So stay tuned right now. I'm going to show you how to download my book. Download it, keep it on your computer, your iPad. It's a fantastic, you'll see it. I explain things very easily in the book. There's videos throughout the book. There's all the links that you need now and in the future for all your Medicare stuff. And then I'll also tell you a little bit about Medicare Price Check, where we can do comparisons for you year after year after year to make sure that we stay in the right spot with Medicare. So I hope you found this helpful. Stay tuned. I'll show you about my book. Have a great day. Thank you for taking the time to watch my video. I hope you found it very helpful. Here are a couple other things that you'll also find helpful as you go through Medicare. The first one is a copy of my book, Medicare Made Clear. You can download it right now for free. I've put a lot of time and effort into this book, and you'll see I cover just about every piece of Medicare, and I've written it in a way that makes it pretty easy to understand. Now, I also have videos throughout the book, so if you don't want to read through all the information, click on the video and I'll explain it all to you right there. You'll also find all the links that you need to either sign up for Medicare or things that you're going to need now or in the future when things come up related to Medicare. So take just a minute, go to medicareonvideo.com/free book, and you can download it right now. Now also make sure once you're in Medicare that every year you come back and visit Medicare Price Check. This is my other website where I make it super easy for us to compare our current coverage against new plans that may be less expensive. And remember that Medicare supplements are standardized, so it doesn't matter which insurance company we use, we'll still have the same Plan G or the Plan N that we have now, but hopefully we can get it at a lower price. So visit MedicarePriceCheck.com. Real easy. We'll email you the quote. If it makes sense, then we'll do it from there. So I hope you found all this helpful. Have a fantastic day.